Good evening, everyone. So, myself Shivani Mishra, and I welcome today's speaker, Dr. PIYUSH Juneja. He is Ayurvedic expert with the experience of 14 years, graduated from Ayurveda Gurukul Ayurvedic Medical College, Haridwar, and post-graduation in the clinical research and MBA project management. He is a member of Board of Advisors for the Canadian Association of Ayurvedic Practitioners. He is currently practicing Ayurvedic physician and also a consultant to the several national and international organizations. Dr. PIYUSH has held various positions and was responsible for management of clinical trials, regulatory affairs, research and development at the GlaxoSmith, Biomed Canada, Max Neiman International Catalyst Clinical Services, BioInnovat. So this is the importance of today's webinar, that in India, India is having the second most highest population after China, comprising of 1.3 billion people. And this is the major issue of overpopulation. And second issue is the infertility. According to the report of the Indian Society of Assisted Reproduction, that is ISAR, 10 to 14% of Indian population suffers from infertility. According to estimates, according to an Ernst and Young report in 2015, about 27.5 million couples in India wanted to conceive, but they are unable to do it naturally. So, as per the newspaper report, here we can see that there is a higher infertility rate in female than in males. And the major causes are the lifestyle and clinical factors. So the treatment here is the lifestyle changes, usage of fertility monitors and IVFs. And the issue in treatment is lack of awareness about ovulation tracking products like fertility monitors. So I must tell something about Curia. Curia is about primary objective is health for all and provide accessible, affordable and quality healthcare system by reducing the medical expenditure and eliminating the information asymmetry. So basically हम लोग medical expenditures को कम करने के लिए and information asymmetry को हटाने के लिए इसके लिए हम health awareness create कर रहे हैं. And we have created website like you can visit the website curia.in, Facebook, connect through WhatsApp, YouTube, Twitter handle channel, Instagram, LinkedIn, and email. So we have online services, like we are conducting the webinars for doctors and practitioners. You can visit the upcoming webinars and the previous webinars page on our website. Then comes the online doctor's appointment. You can book the appointment through Facebook and website. And here we have the upcoming services of e-commerce platform that we are going to launch soon. So keep checking our website. And here is the previous webinars we have already conducted. You can check out the list of the previous webinars. Go through our YouTube channel and just whatever topics you find it interesting, you can check there. So quote for day is the first wealth is health. Thank you. I would like the sir to present the today's webinar. Over to you, sir.
Yeah, good evening all, and thank you so much, Shivani, and to the platform that is Curia, and I welcome you all in the today's webinar. So let's start the today's topic. and thank you so much for the nice introduction. So let me start with the today's topic, that is Ayurveda and infertility. So as already it has been shared by Shivani as far as the data is concerned, and we all know that infertility issues are growing a lot as far as our society is concerned. हम देखते हैं daily aspects, these issues are like growing, and due to the stressful life, the anxiety, the various professional aspects, marriages are being delayed, generally in late 20s or late, sometimes late 30s, mid 30s or late 30s. People are getting settled, and due to that, they are facing several issues as far as infertility is concerned, male and as well as females. And in Ayurveda, we were able to help and heal. I think till now, thousands of cases we have done, and most of them are being healed easily with Ayurveda treatment and Ayurveda solutions. They were not finding any good solution in other pathies. So Ayurveda in that scenario is very effective, and both for male as well as females, we have seen very good healing results. So, however, in Ayurveda treatment, there are several dimensions and several aspects which we need to understand. So, let me just quickly go through some facts, and already as it has been discussed. So, if you talk about developed countries like US, you can see that there are several issues, and one thing I want to quote here, and in fact, you are seeing this data, and it is almost same in any country. That generally what happens is, like for example, in our country, the taboo and the mindset is, whenever there is some issue in terms of infertility with a couple, most of them are, the families are only blaming the females. But however, if you see the data, it is equal. 40% are due to female factors and 40% are due to male factors, and 20% are the combination in which both couple, male and female partner, are having some issues. So if you see around 60% in which males are also having the reasons or issues as far as infertility is concerned. So it's not only about females every time. So that aspect I want to raise on this platform, and I want to request all the audience who are listening to the session today, please develop this mindset that infertility and issues related to infertility can be related to both genders. It's not only about females always. So please ensure that this mindset is being developed in our society, and all over world, if you can see, so there is some data as far as last year, till last year is concerned. So total fertility rate is, the darker the color is, the more fertility is there, and the lighter is the less fertility. So you can see mostly the developed countries are shifting towards the lighter aspect, and the fertility or the child born per woman ratio is decreasing. And in India also, however, on one side, we need to understand, and we are saying that okay, we are sitting on a population explosion, and we want to limit our population. On the other side, at least one child, one or two children should be there. At least one child should be there, which people are aspiring. On one note, some people can say okay, there are orphan child, so in that way they can be adopted and all. I do respect to this feeling and this mindset. Still, getting a natural child and a conceiving in a natural way is an aspiration, and it's a way of bringing new life to this world, and all of us have been gone through this process only. So yes, we always also understand all the other aspects, and still, if we can say, and some countries are in fact on the negative growth as well. Some countries on the negative growth in terms of the fertility or the population is concerned, and these are some projections. So again, you can say that okay, if the blue getting darker means less fertility, and the projection is less than 1 or 1.5 on an average, is will be there in the maximum countries. Only African countries are left, but otherwise entire world is facing this issue. It's not only about India, by the way. So I request all of you to, let's understand and let's explore what are the reasons and what are the causes. As I said initially, males and females are equally responsible, and then there are certain mixed cases as well, mixed causes also, and some aspects are regarding the unexplained infertility. So there are many reasons in which we can't explain that okay, this is regarding that female issue or male issue or anything. It's just an unexplained infertility, but we have seen good results and good healing in that cases as well. So prior to talking to this aspect, prior to giving all of you some guidance and some insight as far as the infertility treatment, infertility diet, lifestyle, and those aspects are concerned, you should also understand and you should also know, if you are listening to a particular speaker, like for example, I am there as an Ayurvedic, so um, you should follow me or not. Like, am I already able to deliver what actually exactly the aspects I will be talking in this session or not? And the most important aspect is actually the patients are getting healed or not. And the best possible way of understanding and on believing someone is by the real time reviews and the real time data or the real time facts which are available in the public domain. And we all are living in the era of digitalization, social media, social networks, platforms, Googles of the world. So all of us are available there, and most of us are present. So it's like very candid these days, and people are very transparent. In a very transparent way, they are sharing whatever the positive or negative feedbacks and reviews they have for someone or some organization or whatever. So like, we are having this clinic. So for example, this person, he was having some issues, and they got connected with my team, and we were able to heal them. We were able to give them the proper treatment with the guidance on the diet and lifestyle. And within 4 months, as it has been written, that they were able to conceive naturally, and now they are blessed with the baby girl. So these are some examples which I want to share prior to starting my talk, so that you people will be able to correlate, and you will be able to have that understanding and have that uh, credibility factor or trust, that okay, this speaker is already helping people, this doctor is already helping people in terms of getting healed on infertility. And yes, we should focus now what exactly he wants to talk, what exactly he wants to guide us, so that we all can help anyone in our families, network, friends, or whosoever is having this issue of infertility. And we should spread this word and spread this message to the entire society, that yes, Ayurveda can help, Ayurveda treatments can help cases who are having some issues in terms of the infertility is concerned. So last year, as you can see, one of our patients, she contacted us, and she was having some cyst. So PCOD, ovarian cyst, all these issues are very common these days in females, and they are not able to conceive due to that. So with Ayurveda, within 6 to 7 months, we were able to heal this lady, and ultimately she has delivered a baby boy, a healthy baby boy, and they both are doing fine now. So the point is, as I said, there can be some reasons. Like in this case, it was clear that the female is having issues in terms of the cyst, in terms of the PCOD, and we healed that issue, and now she is able to conceive, and now she has in fact delivered the boy as well. So we need to diagnose, we need to see the root cause, see the reason why the infertility is there, and accordingly, if we start the treatment, if we do the treatment, healing will be done, and the people will be getting benefited. So these were some examples. Another example is there. So she was having some para-ovarian cyst, and then we were able to heal her as well. So there are so many examples which I just want to again, the person, you can see that they were having issues as far as um, again, infertility issue was there, and around 5 months, after 5 months, they were able to get healed as far as the treatment, Ayurveda treatment is concerned. So there are so many examples is there which I've just shared with all of you, and there are lots of other reviews, feedbacks, and you can see how people are getting healed on the Facebook page or Google listing of our clinic. So now let's understand what exactly the infertility is, and how we can ensure that we are being like we are treating our issue and we are getting healed. So first of all, we need to understand that it is a disease in which the reproductive system defined to achieve the it's like failure to achieve the clinical pregnancy after 12 months or more. of a regular unprotected sexual intercourse. So if a couple is trying from last 1 year without any protection and they are not able to conceive naturally, then medically we call it as a infertility, and then we will think and we will find out the reasons that okay, why they are not able to conceive, and accordingly we can start the treatment. There can be several issues as far as the infertility is concerned for males as well as for females. So there can be issues with males like erectile dysfunction, premature ejaculation. There can be some hormonal issues, sperm count is less, or there are some issues with the motility and morphology of the sperms. So these are some issues which are there in the males. And in Ayurveda, for all these issues which are mentioned, we have very good solutions and treatments which we can take it from any, in fact, a good Ayurveda doctor, and we can get healed. As far as female infertility is concerned, so we have PCOD as a reason, we have fibroid, tubal blockage, ovarian cyst, low levels of AMH and all. So these are some reasons. PCOD is polycystic ovarian disease. So there are multiple cysts in the ovaries due to which the ovary size get increased, and accordingly they are not able to conceive. Then fibroid is a kind of a structure being developed in uterus. Uterine fibroids are there, and due to that, females are not able to conceive. Then there are some blockage in the tubes, and ovarian cyst, low AMH. So these are some issues due to which females are not able to conceive. Then there are diet and lifestyle issues, sedentary lifestyle. We are not doing any workout. We are not doing any physical activity, irregular diet patterns. We are working late nights, so much of stress, anxiety related to work these days due to lockdown. And now things are opening up. Still, many people are isolated. They are depressed. They are mentally having issues with their health. Then, as I said initially, marriages are getting delayed, and people are getting married in late 20s, mid 30s, or late 30s sometimes. So we have seen after 35, there is a significant decrease in the fertility aspect of any person, be it male or female. Then lack of awareness is there. As I said, in terms of we always think that okay, females are the reason, but many times we have seen females are absolutely fine. There are males having issue as far as infertility is concerned, and due to that, they are not able to conceive. So awareness should be there so that we can track and we can find out the exact reason of infertility, and accordingly we can heal that case. So awareness is very very important in terms of knowing about the infertility issues and the reasons which we are having. So all these are the reasons, all these are the causes in which we need to identify as a doctor, as a medical person, and you all should be aware about this. Why? Because you should understand and you should accordingly take your decision. Okay, if these are the any one of this is an issue, and you should get a checkup as soon as you identify that okay, there is a significant time now has gone, and as a couple we are not able to conceive. So these are some reasons which you should understand, and accordingly you should correct that and heal that, so that like as I said about the solution. So first and foremost in Ayurveda treatment also we always recommend that diet is very very important. We always determine Prakriti in Ayurveda, and accordingly we prescribe the diet. In general, you all should take healthy grains, take less wheat, and take more healthy grains like millets, quinoa, rice. You can take without starch, so you can destarch the rice. You should increase protein and iron in your diet. Take adequate quantity of fruits, fluids, and avoid trans fats or saturated fats, which are there in so many food products. You should always do some regular walk, some basic yoga, asanas, pranayam, meditation. So all these healthy lifestyle aspects you should all maintain, so that your body and your overall fitness level is fine, and then people are able to conceive naturally. We have seen these days many people are having sedentary lifestyle. They are not doing any kind of a physical workout, any kind of a walk, exercise. Now things are opening up. Earlier things were closed, so now at least we can go for a walk. We can go for some kind of an exercise in parks or in our lane or whatever. At least you can do some home activities and home workout sessions, some basic yoga, some basic aerobics, or some light walk you can do in all your areas. So I please request all of you to maintain a healthy lifestyle. As far as medical management is concerned, there are several Ayurvedic medicines and Ayurveda treatments available in herbs or herbo-mineral formulations are there. However, I request all of you, there is um, one point and one caution I want to raise here is never ever take any Ayurveda medicine without the supervision of an Ayurveda registered Ayurveda doctor. Many times we have seen, we think that okay, Ayurveda uh, is safe. Ayurveda, like we have some herbs, so Ayurveda is not having any side effect, or these are just some basic herbs, or we can just online order, or we can just check on a nearby chemist shop and take any Ayurveda medicine. We do sometimes I've seen people are doing some Google, okay, Ayurveda treatment for infertility, and they are just randomly picking up some medicines and they are taking those medicines. See, Ayurveda medicines also will have side effects as well. So it's not that Ayurveda being herbal is 100% safe. If you are not taking under a medical supervision, under an Ayurveda doctor, Vaidya, which we are known as, you will be having issues. And many times we have seen cases are getting complicated and worse also. So see, there is a system, there is a protocol, and there is a reason why we are spending 6 7 years in studying Ayurveda, and then we are being licensed, we are being registered by government of India, and we are being authorized by them to practice Ayurveda. So my request to all of you is please refer to a registered Ayurveda practitioner or a doctor having experience on dealing with infertility cases, so that he or she is already aware about all the aspects and they can provide you adequate treatment so that you people can get healing out of that. Then there are some procedures as far as Panckarma treatments are concerned, like detoxification, per vaginal treatments like Uttarvasti and all for females. So, uh, apart from the medical management in Ayurveda, there are Panchkarma treatments, and we can say that detoxification treatments and therapies are also there, which always help and increase the chances of getting healed in a lesser time. So my request to all of you is please, as I said, consult a registered, experienced Ayurveda doctor, and under their guidance, you can start treatment. These are some general herbs or general supplements. As healthy individuals sometimes ask me, okay, some tips or some herbs you can say. Still, I again say that never ever take, as it has been written in the bracket, under medical supervision. Still, herbs like Safed Musli, Ashwagandha, Shatavari, Ashoka, saffron, these herbs we have seen are having very good results in terms of the increasing the fertility is concerned, be it male or female. And especially in females, Shatavari is very good. And in males, we have seen saffron or Safed Musli having very good effects as far as increasing the fertility aspects are concerned. So, but always consider and always talk to your Ayurveda doctor, and then only start any these single herbs or supplements also to get a good and healthy life. So that is my request to all of you. This is just a picture to show that yes, in our practice, sometimes our patients share these kind of pictures with us, which make us happy and which ensure that our efforts and our dedication towards this profession is being fulfilled and being taken care of in terms of providing someone a new life, providing someone a better life in terms of healing and in terms of resolving their problem is concerned. So I request to all of you, we can have various questions on like, okay, there are so many pathies, so which pathy we should follow? Uh, like we are talking about Ayurveda. So as far as Ayurveda is concerned, Ayurveda is a system in which we do the treatments from the root cause. We always say that prevention is better than cure. We always follow that principle in Ayurveda, that we first guide to ensure to increase the quality of life, to improve the quality of life, to improve the diet and lifestyle aspects of your life, and then we talk about treating the issue as well. For example, let me just go back and explain again. For example, this diet, I want to explain a more on this diet aspect. So if you see, okay, aspects where we can have healthy diet in terms of increasing our fertility is concerned. So what you can do is you can have adequate quantity of diet ingredients or products which are rich in minerals and vitamins. For example, dry fruits. Dry fruits are very rich in minerals and vitamins. So have a combination of dry fruits like almonds, walnut, foxnut, that is makhane, raisins, that is kishmish, dry dates, that is chuare, and all. So have a mixture of this and daily take one handful of these dry fruits, which will help you a lot. Second tip is, for the diet you can have a seed mixture also. These days so many seeds are available, like sunflower seed, melon seed, chia seeds are there. So you can have these kind of various combination of seeds, and you can again prepare a mixture, and you can take daily couple of spoons, either with water or milk, whatever is fine with you. And that these seeds are also very very good in terms of concentrated form of minerals and vitamins is concerned. Then if you are a vegetarian, you should focus protein diet in terms of soya, in terms of whole pulses, in terms of paneer, and these kind of stuffs you should take regularly. As far as protein intake is concerned, that is very very crucial. We have seen in India generally people are deficient, having deficiency of protein. If you are a non-vegetarian, definitely you are getting good protein in terms of egg, chicken, seafood, and all. But in vegetarians, we have seen sometimes there is a deficiency. There is a basic formula to understand that if your weight is, for example, 50 kg, you need 50 grams of protein. So accordingly, you should take in your daily diet. Especially in females, we have seen deficiency of iron, calcium, that kind of stuff. In Ayurveda also, we have so many medicines which we get the origin from the natural sources, like iron. We have several preparations in which natural source of iron is there. For calcium, we have so many preparations in which the herbo mineral source and natural source of calcium is there. So these can help you in fulfilling the deficiency if there is any. And we have seen in mild cases sometimes, and in cases of unexplained infertility, in which there are no exact diagnose, you also sometimes get confused that okay, all your reports are fine, normal, then also you people are not able to conceive. We have seen several times that these kind of deficiencies are there, and when we address these deficiency, when we ensure that they are getting good adequate diet, they are able to recover and they are able to conceive. So these deficiencies should be taken care of, and accordingly you can focus and start the journey of your healing. And for lifestyle, as I said, walk, the formula for walk is at least daily have 10 to 12,000 steps in a day. At least have daily 10 to 12,000 steps in a day. You can do in two parts as well, morning 30-40 minutes and evening 30-40 minutes, or maybe 1 hour at a stretch. Then yoga, the basic asanas are there, pranayam and meditation. Anxiety, stress, tension is very very significant factor, and directly impacting the fertility of all the people these days. We have seen corporate world, people are involved and busy in their corporate lives, in their professions, in their personal life also. They are sometimes alone. There is a depression. There is a stress or anxiety. So meditation and ensuring that we are mentally also healthy is very very important. And I request all of you to ensure that you all of you are happy, because happy or happiness index is also directly related to your fertility. So please ensure that in your lives. And I request all of you to be connect with us. These are some awards and recognitions we have received till now, and we are helping several people in terms of getting healed. So I think let's start with some questions, as far as queries and questions are concerned. So this was just a brief idea about infertility, and you all can now please ask questions, and I will be very happy and pleased to answer any queries and any questions are there.
Sir, I have some questions.
Yes, please.
Hello.
Yes, please.
Could smoking, alcohol, or stress affect the fertility?
Very good question, by the way, an excellent question, and I think I missed that aspect. Thanks for taking up this issue. See, as far as smoking is concerned, nicotine is directly related to the fertility, impacting the fertility, and it decrease the hormone levels, it decrease the reproductive capacity, and in males we have seen it is directly impacting the issue in terms of their uh, relationship performance in terms of their general weakness, their stamina, and all. And in females, it is directly impacting the reproductive organs, that is, ovaries and uterus. So, we highly recommend to stop smoking as soon as possible, or any other tobacco intake or nicotine intake, because this is directly related. As far as alcohol is concerned, yes, alcohol also impacts a lot. Alcohol also significantly impact males as well as females in terms of the fertility aspect is concerned. However, sometimes in some aspects we have seen that at a very less frequency and at a very good quality, it's not affecting that much. However, as a medical professional, I'm not advocating, but I always request to my patient to stop alcohol and smoking as soon as possible, as we determine that they are having issues regarding the fertility aspects are concerned, because yes, both are directly responsible and directly impacting the fertility of males as well as females medically.
The second question is, what are the various specific tests to diagnose the infertility and treatment options available? Are there any side effects from the fertility treatments?
See, as far as the tests are concerned in males, what we have, what we are recommending is, one is serum testosterone level, that is the male hormone, and semen analysis, which we need to see in terms of the sperm count, in terms of the motility and morphology of the sperm, so that they are able to conceive naturally or not. Many times we have seen that there is a decreased level of testosterone level, or there is a significant decrease in the sperm count, and due to that they are not able to conceive naturally, which we can easily heal with Ayurveda. Now, as far as females are concerned, so tests like AMH, that is the primary test for checking the fertility levels in females. We are doing then estrogen, prolactin, uh, FSH, LH. So these are some hormonal tests as a clinician we are recommending. And also we are doing an ultrasonography, especially for checking the uterus and ovaries, that if there is any cyst, PCOD, uterine fibroid, or any other issue, ovarian cysts and all, or any kind of blockage, we recommend to do some kind of a CT scan or MRI as well, to understand that okay, if there is any anatomical issues as far as females are concerned, and then we determine and accordingly we proceed. Now, if you want to discuss regarding the treatment options available, see, every pathy is having several treatment options. I don't want to criticize any pathy on this platform. However, every pathy is having their own limitations, and we have seen in Ayurveda, however, generally many times people come to Ayurveda after exhausting all other therapies, all other treatments. And we have seen Ayurveda is having a very good success rate in terms of healing the infertility cases. In fact, in our clinic, more than 90% cases till now, till date, we have healed with Ayurveda. So there are various treatment options available in allopathic. There are hormonal pills. There are procedures like IUI or IVF. But sometimes all of these are getting failed, and then they are resorting to Ayurveda, and we are helping them out with Ayurveda solutions also. But yes, every pathy has some solutions. So my suggestion and my tip of the day to all who are listening to us today is, first try the medical management, be it any pathy. If that medical management is not able to heal you, you can go for some procedures. As I said, in Ayurveda also we have some therapies. Then the last option can be like procedures like IVF or IUI and all. So these can be the last procedures or the last option. If you have exhaustive all other options, आपने अगर सारे options और try कर ली हैं, and still you are not able to get healed, then maybe you can go for the final option, because these procedures are costing also a bit much, and accordingly, and if you are getting failure in that also, then your chances will also be decreased more. So rather than get first of all healed, and there are some surgical suggestions and surgical interventions also sometimes we have seen, but those surgical treatments are also not advisable, and we have seen surgeries generally hampers or decrease the chances of fertility many times. So that can be again the last option. But yes, the medical management and with the systems like Ayurveda, we have seen very good success rate. So it's just people should get aware and people should at timely manner. My request to all the audience who are listening to us is do not delay, please. As the age progress, the fertility is decreased. It's a natural phenomena. The older you grow, the your fertility will decrease. So please do not delay much. Please timely plan your families, so that sometimes if there is an issue, we as doctors can also able to help you out if you are not that much old. But if you are getting old and you are delaying your planning of raising a family, that will hamper the chances of getting a natural conceiving or a natural pregnancy. Right.
So third question is, how much of the cost of the fertility treatments or testing does health insurance typically cover?
See, as far as health insurance is concerned, these days, many companies are covering several aspects. It depends upon your policy. So, generally in India, either the medical, this hospitalization and these things are covered, accidental or hospitalization. However, we have seen that in fertility treatments, there are some surgical process that has been covered, or there are some Ayush hospitalization treatments, because see, the OPD treatment and the medical treatment is not that much of expensive. That is very inexpensive and very economical as compared to the other options are concerned. So generally people do not mind, because more they will spend in their time of claims, or in fact their petrol in their car will cost them more if they want to go for claim and all. So these are very economical treatments as far as the medical management is concerned. But yes, procedures like surgery, procedures like panchkarma, and these are not that much affordable. So some treatments are covered, some are not. Procedures like IVF are very costly, and it depends. Actually, these days what happens is these insurance companies are having various kind of policy. So my suggestion to all is, you can check with your policy, you can check with your company. Sometimes they ask for a waiting period of 2 3 years, and then they activate some options which are available as far as infertility issues are concerned. They also check the baseline when you are taking the policy, if that at that time you were suffering from that issue or not. If you are not, and after that sometime if you develop, so there can be chances of cover. So all these permutations and combinations will be there, and as a customer or as a consumer, you should read your policy, you should read the terms, and you should discuss with your company, and accordingly you can plan and you can take it forward. Because it's not that every policy or every plan will cover infertility. No, there are certain plans which are covering, there are certain plans which are not covering. So in that way you need to be aware, and if you into that zone or that age group in which you want to plan family, and you are in a doubt that it can like your age is delayed, or you are getting married late, or many other aspects are there, then you should plan accordingly and plan well in advance, so that in a timely manner you can take the advantage of uh, claiming taking the claim for your treatment. Otherwise many companies will not reimburse that.
Do the Panchkarma is also covered in health insurance?
Yes, as I said in my presentation also, after if we are not able to heal completely through the medical treatment or the medical management, Panchkarma therapy, several therapies are there. Like for example, specifically in the cases of infertility, what we are doing is we are administrating the medicines. Like for example, in females, so there is known as a procedure which is known as Uttarvasti, means through vaginal route we are inserting some medicines, and we have seen cases in which PCOD, cyst, or tubal blockage sometimes we have seen. So through these Panchkarma therapies and these procedures, we are able to get the healing much um, earlier as compared to the medical treatment is concerned. Then in males also we have seen sometimes there are some therapies of Panchkarma which are helpful, and accordingly we can plan that as second line of treatment. First line of treatment will always be the medical management. But yes, Panchkarma many times helps. Panchkarma many times we have seen improve the health condition, and it directly impacts the fertility. And several times in infertility cases, we have requesting the patients to start Panchkarma also. And after Panchkarma, we have seen very good results and very good healing as well.
Okay. So fourth question is, what is the success rate measured by the live births for each type of treatments?
See, actually, as far as the success rate is concerned, as I said, it depends. Actually, the problem is in various pathies, there are various treatments available. I can't comment for any other pathy as far as the success rate is concerned. But yes, I know as far as my practice of Ayurveda and our clinic is concerned, and our cases which we have healed till now is concerned, we are able to get a success rate of more than 90% in terms of healing and in terms of ensuring that people are getting healed. And many other Ayurveda doctors are getting equal success rate as well, as per my understanding and per my knowledge. So yes, in Ayurveda, actually what happens is initially we see the case and we what we do is we generally accordingly review. So there are some cases which are in that zone, that if there is a permanent damage or if there is any permanent issue which any pathy will not be able to help them out, so we will not consider those cases, because we know from the day first that these are cases which any pathy will not be able to heal. Any surgery or any issue of this any issue of that kind, like for example there is a permanent damage in terms of the internal organs are concerned, there is a permanent blockage in terms of the tubes are concerned, which are not we are able to, partial blockage we have seen many times we can heal, but complete blockage sometimes it's not, like we are not able to heal through medicines or through any procedure also. So it depends. Or maybe there is a damage to the organs like uterus or ovary, or for males testes and all. So we need to see the case initially, and accordingly we will decide, okay, this case we can start or not. But if yes, those cases where there is a scope of treatment, generally we have seen a very good success rate as per Ayurveda practice is concerned, and we are able to achieve that rate with almost all our patients till now.
What is the estimated cost between Ayurveda treatment and if we go by the allopathic treatment like IVF and other treatments?
Again, a very good question. And see, as I said, I don't want to criticize any pathy here. Every pathy and every procedure is having their own significance. I appreciate the efforts of allopathic doctors. I appreciate their commitment, dedication, all the gynecologists, all the IVF specialists. I really appreciate them. They are helping our society. Still, they have their own limitation as far as their pathies are concerned or their procedures are concerned. And in Ayurveda we are able to heal. As far as costing is concerned, in Ayurveda there are the costing is just few thousand, nothing else. And in IVF and those procedures, generally institutes or hospitals are charging anything between few lakhs. So if you compare the costing, Ayurveda is very economical, and it's a kind of an inexpensive in few thousands, or maybe maximum the complete treatment will cost maximum to maximum 15,000, 20,000 maximum. That is also to those cases where treatment is going a bit long. But if cases are getting healed in 3 4 months, so it's just a matter of 10 12,000 maximum, not more than that, as far as Ayurveda is concerned. Or maybe maximum you can go for 15 to 20,000. That's it. I don't think so more than 20,000 any case we have done till now. But yes, in procedures like IVF and all, you have at least you need to invest 1 to 1.5 lakh, or sometimes 2 lakhs people are charging. And accordingly, you can see if the results are there or not. And we have healed so many cases of IVF failures also in our clinic as far as Ayurveda treatment is concerned. So again, as I said, I appreciate the efforts of gynecologists. I appreciate the efforts of IVF specialists and the centers and the hospitals. But still, they have their own limitation, and those we can easily are like able to heal in Ayurveda.
Next question
Your voice is breaking. Actually, I'm not able to hear properly.
it is response.
Hello.
Hello,
Yes,
sir. I'm audible.
your voice is breaking. I think there is some issue with the internet connection.
Hello.
You can type in the chat as well. Like you can type in the chat box your question, and I can answer, because there is some issue with your voice connectivity. So you can quickly type in the chat box, and any other, I can see there are so many people who are watching us and attending this session. So all of you can post your query now and your question. If you want to ask anything, we'll be able to address those questions as we have some time right now. So please let us know if any question you people have. In the chat box you can type, and I will read from the chat box and I will answer your questions also. It will save time for all of us. So quickly, please let me know if you have any query. Okay, so the question is, how much PCOD is responsible for infertility? Again, a very good question, by the way. As far as PCOD is concerned, PCOD is very much responsible. In fact, all the cases of PCOD are directly related to infertility. And those females who are suffering from PCOD will not be able to conceive till the time we are not healing PCOD. So PCOD is polycystic ovarian disease, in which there are multiple cysts in the ovaries, and due to that there is an abnormal secretion of hormones, of female hormones. So there are irregularities in the monthly cycles. Either they are not able to get on time, the flow is very less, the pain is very much, it's very painful sometimes. So all these directly impact the fertility aspects of females, and due to that they are not able to conceive as also. So in PCOD is directly related to infertility, and all the cases and all the females who are suffering from PCODs are not able to conceive actually. So in Ayurveda, we heal PCOD easily with Ayurvedic medicines, Ayurvedic treatments, and within few months we are able to see a significant decrease in the ovary size and healing of the cysts, and then uh, all the females are able to conceive naturally and easily as far as the infertility issue is concerned. So yes, it's absolutely connected, and we should so as far as Ayurveda treatment for PCOD is concerned, there is medical management, uh, and there are some diet and lifestyle recommendations as well. And as you are saying about the young girls, you again raised a very valid point and very good question. These days so many teenage girls we have seen are suffering from PCOD in puberty and in their young age. They are suffering from PCOD, and the main reason is irregular diet and irregular lifestyle, which we are all are having these days. All of them are only like involved with the gadgets. The physical workout and the physical activities are very limited, and diet is also a bit irregular. Late night or awake, they are awake till late nights, they are sleeping very late. Diet is very irregular, fast food, junk food, so much of anxiety, stress these days in teenage groups we have seen. So these are so many reasons in which we have seen a very sharp rise in the cases of teenage girls as far as the PCOD is concerned. So we always, first of all, counsel all of them. We always ensure that a healthy lifestyle is being followed. We always recommend to stop immediately. Too much spicy, too much oily, too much chili. These aspects we always need to understand, and we always uh, explain this to all the cases. And I request all the audience who are listening today that please follow these diet. As far as you need to avoid too much spicy, all the red and green chilies and all. Please avoid that in cases of PCOD. Please avoid saturated fat, junk food, fast food. Always take fresh fruits, vegetables, healthy grains. Take plenty of water. Many times we have seen people are drinking less water. So at least have an adequate quantity of water, that is 1.5 to 2 liters minimum in a day, and go for a regular walk, go for some physical activity. Teenage girls should participate in some kind of an activity like dance, aerobics, sports, or these kind of stuff. So this will help to regulate the metabolism. This will help to regulate the uh, hormonal level, and it helps in healing PCOD also. As far as Ayurveda treatment is concerned, there are so many medicines available. We as Ayurveda doctor can easily recommend, and, and it can be easily healed with Ayurveda medicine. So I request to all of you to please consult an Ayurveda doctor, and PCOD easily we can heal with the medicines. Otherwise, generally in other pathies, there are hormonal treatments available, but they give side effects, especially in the cases of teenage girls. We can't afford that, because it will then have the consequences of some side effects like facial hairs, hair fall, acne, and that kind of stuff. So I request all of you to get resolved this with Ayurveda, and it will definitely help you in also minimizing the other side effects, that is acne, hair fall, and facial hair, and that kind of issues, which generally we have seen PCOD in PCOD cases people are facing. Right. So any other question? Okay. So there is one more question. Nowadays, girls are having irregular menstrual cycles. How it can be regulated? And again, a very good question. See, what happens is we need to see that, okay, why irregular menstrual cycles are there. So as I said, there are so many aspects which we need to understand. And these days, due to this irregular diet and lifestyle, due to the mental anxiety, stress, depression which we are having, due to the, I can say, the mindset should be developed in a healthy way as far as our next generation is concerned. So, and females are having so many responsibilities as well at a very young age these days. So, and also very important crucial aspect of, especially in the tier 2, tier 3 cities or villages sometimes, the a very important aspect of sanitization, a very important aspect of monthly cycles being protected and ensured. And I thanks to the government and several initiatives now. And we have seen that our respected Prime Minister has addressed this issue from the Red Fort on this Independence Day, that government is working in developing a sanitary pad at a 1 rupee cost. So that is very important and very crucial. Still, we have a large segment of females, a large segment of girls not having access to the sanitary pads, and that is a very common reason for irregular menstrual cycles, because it causes local infection, it causes problems like white discharge or irregular cycles in terms of the duration, in terms of the intensity, in terms of the pain. So we need to understand that as far as in our society is concerned, these are the some serious concerns we have. And as far as the urban population is concerned, we always ensure and we always request to all the females, because we need know that being a female, being a girl, you all are having so much responsibilities, and you all need to handle so many aspects in your life. So please be happy always, because many times we have seen that females are a bit stressed or in a bit of challenging phases of their life. So please be happy, because psychological aspects are also directly related to your hormonal cycle, and that directly impact the frequency, intensity, and the duration of periods. In Ayurveda also, we always recommend to follow a healthy mental state of life as well. So, and we have so many solutions and so many aspects which we always recommend to our patients. So I request to all of you to please have that important aspect in your lives, and then accordingly you can manage and you can have the healthy life, and you can control and ensure that this problem of irregular menstrual cycles can be controlled. Now, how we can regulate is, again, we have so many herbal tonics and herbal syrups or medicines available in Ayurveda. There are very simple herbs, like for example, Ashoka is a herb, and we know that we have this Ashoka wrist and all. Again, I don't want to quote this that you people all who are having irregular cycles can start taking Ashoka or Ashoka wrist and their problem will be solved. No, as a doctor we need to see various aspects, but this is just one example which I want to quote here. And ashok is a herb which has been uh, researched exhaustively and shown very good effects in terms of regulating the menstrual cycle. So you should again contact an Ayurveda doctor if you have this issue, and they will help you in terms of regulating the menstrual cycle. You should go for a regular walk. You should always maintain a local hygiene. A very important aspect which I see many times due to the lack of awareness or due to some hindrance, some inhibition, that many girls are not able to get this information from their mothers or elders in their household, that they need to maintain a local hygiene as far as their private parts are concerned. So that lack of awareness is also still prevalent in our society, and that is a main cause for the irregular menstrual cycle sometimes which we have seen. White discharge, many times we have seen females are not aware that this is a disease or this is an issue which can cause irregular menstrual cycle. And in Ayurveda, again, with few simple herbs, within sometimes 1 or 2 months, maximum 2 months, we are able to heal problem of this white discharge completely with Ayurveda medicine, with very simple Ayurveda medicines. And maximum in 2 months, we have seen a very good healing in all the cases. And after that, their periods were also being regulated, and they were coming on time without much pain, and bleeding was also normal. So these are the simple aspects which we need to understand, and accordingly we can help in various problems of irregular menstrual cycles are concerned. Right.
So I think the questions are over for today's webinar. And thank you to the participants and the speakers, sir. Sir, uh, thank you for sharing the knowledge that most of the audience require in today's to correct the lifestyle disorders. So
Thank
now,
you so much. Thank you so much for inviting me on this platform. And I request all the audience who are listening to us today, please spread this message. Please spread this information in your respected families and friends and networks and in the society, that we have excellent solutions as far as our own Indian system of medicine, that is Ayurveda, and we are being seeing, we are able to help thousands of people, and we are seeing very good results. Still, I have seen so many people are not aware, and they are still confused, or sometimes the lack of awareness or education is there. So I request all of you, the aim and the purpose of doing this webinar, and I again congratulate this platform also for coming up with this topic which is need of the hour, and you people are doing very good job. So I request all of you to spread this information and to share at least the video of this session, which is available on the YouTube channel of Curia. So uh, we can at least do this. We can share on our respective timelines, so that the entire society, at least who are connected with us, are being aware now that yes, we have good solutions in our own Indian system of medicine in terms of infertility, in terms of female gynae issues or male issues are concerned, and we can help them, and whosoever is suffering can get it healed with a very very minimum cost, as I said, and with very safe and effective treatment options available. Right.
thank you, sir. Thank you to all the participants.
Thank you. Thank you for inviting me. Thanks.
Thank you, sir.